Hello, and welcome to the COVID-19 beauty industry response. I am your host, Gwendolyn Barber,
And I'm there.
and we will be bringing to you important information about the occupancy rules, bloodborne pathogens, social distancing, and hand washing um, practices that should be implemented into the different barber salons, beauty shops, hair braiding shops, skin specialists, and nail salons as a practitioner and as a salon. So we have put together a PowerPoint presentation that we will present to you and enjoy the presentation.
Okay, to all the beauty and barber industry people that are out there looking and listening to this video, please like, comment, and share if you get a chance. But this is just some of the things that we see as activists in the industry that would be possible changes that could save lives as well as put us back into the salons and shops together. Take it away, Miss Winfrey.
Okay, so our first PowerPoint focuses on the salon waiting area. And the salon waiting area is important, an important factor because a lot of salons and barbershops and all of the other, we may say salon or shop, but we're covering all of the beauty industry establishments. And so that waiting space is generally at the time for your walk-ins, when could possibly be where you generate the bulk of your income. With this COVID-19 spread and the way that it is working, it's spreading. We are saying that space area in the salon is going to be very limited to none.
Yes. Even with the space area in the salon, if you already have 5 booths in a waiting room, you may not be able to expand to even add booths, being that the occupancy rule is 10 people or less. So with 5 barbers and having 5 potential clients, there's no room for anyone else in there. So you might, and you will definitely have to distance those stations even further now. So
So you ask now, what am I supposed to do? Well, at this point, we believe we should be practicing our best efforts on appointment scheduling. It's going to be important for you to schedule appointments in a timely manner where your clients you know what you're going to do to your client, and you're going to be able to do that in that time frame, as well as having some time set aside for you to also be able to come in and properly sanitize and disinfect your area, your capes, and all of your implements and equipment.
in between each client, this is going to have to be set aside time of at least 15 to 30 minutes just to re-prep your station in order to style and accept those clients that you'll be scheduling.
So we go on to, if this is so important that we're not going to be asking people to sit in the waiting room, and if an appointment runs over or they come in and they're too early, we're going to be asking them to wait in their cars and things of that nature until their appointment time. So we come to the question, how do I service my client?
Well, in most braid salons, they're used to working with 2 or 3 people at one time on one head. And now with social distancing, that's not going to be something that you'll be able to do. Not only when you style a child's head, the child may have to be in the salon by his or herself without a parent. The parent may have to wait in the car, or you may have to develop some type of relationship knowing that child, that that child will be staying. But having 2 or 3 hair braiders on one child head um, that's not going to be an acceptable thing.
So social distancing will be very imperative when we are making decisions on how to service our client and yet still protect ourselves. So we're going to have to use some personal protective equipment.
Yes. And in braiding, the personal protective equipment you may want to use are gloves. However, I know certain fingers you may want out, so you may want to use the little finger rubbies or cut the finger out of the glove. But you're gonna want to protect yourself because COVID is a bloodborne. It's a airborne pathogen as well as it's a surface pathogen that lives on implements and surfaces for a amount of time, as well as it could be in bloodborne. So, you just don't want to leave yourself open to those infections. So you're gonna want to wear a mask. Okay, these women are of course wearing their religious garments. However, you can make a mask for your client. And at the end of this video, we have some mask making classes for you later.
But as we look at this video, we see them with a mask on, but something that we don't see them practicing is social distancing. So at the same time, we're going to ask our hair braiders to no longer practice multiple artists on one head to complete their design, because that could possibly be some cross contamination of the COVID-19 virus. And so that would also be, but everyone else we would suggest, it's recommended that you do wear gloves. And as Denise mentioned, the thumbnails for you to, this is something that we should have been practicing against bloodborne pathogens long before COVID-19, as well as disinfecting and sanitation of our spaces and our salon spaces, just to protect ourselves and our clients as well. So we kind of went into the next slide already, which is how do I protect with my hands? How do I protect my hands and into the bloodborne pathogens? So do you want to get a little bit more in depth about the disinfectant of the implements and the equipment? Because that is something that we are again going to have to step up and go back into. Some of us are licensed with the state, and so that would mean you went through a training that instructed you on um, implements, sanitation and disinfecting of implements and equipment, and monitoring a lot of salons. You don't see those practices fully utilized, and at this time it is important for you to fully utilize those skills.
Yes, I would say that it's very important that you utilize a thimble, whether you went to beauty school or not, because beauty school didn't teach you that you need to use that thimble because they're not teaching you about the needle. But also, you need to sanitize and disinfect those needles. Okay, you need to disinfect those steel rat tail end combs. You need to disinfect your brushes and everything because at this point that no one knows what this virus and how long it lives. Okay, so the equipment that you have, your station, your chairs, your blow dryer, all of these need to be safely sanitized and disinfected after each client. And if you can do it after each client and do a brush up before each client, showing that client that comes in and walks into you that you are doing infection control. So it's something that you will want to present to them as well. Before they sit down, you wipe off the chair and everything, even though you know you just did it because somebody just got up. Okay, so it's double cleaning now. We're doing double cleaning to keep this disease away from our industry.
And out of our salons, which has historically been known as the mom and the only standing, the last standing mom and pop is the entities. In a lot of urban communities, this is the only thing that we still have some stake in is our beauty and barber shops and some of the hair braiding establishments. So it's important that we protect what we have left, to say that it's bonded to us culturally, and also to stand up on that we are should be well trained and understand the safety, health, safety, and sanitation of a salon, because we are dealing with individual people and having contact with them on a constant basis every day. And so these are practices that we should have been practicing, but they are also things that now, as Denise said, we should put a double effort into, as well as we come off of the stay in places in the different states within the United States. We would ask that everyone would go and do a deep decontamination of their establishments. So our next question will go into, we kind of answered it a little bit, but who needs a mask? And how often should we be washing down our hands and disinfecting our space?
I know for a fact that everyone needs a mask, and I would suggest that you make a mask as well as make your client a mask in that prep time that you're cleaning the station after someone gets up. That way, you have a mask for the next client that walks through the door as you're wiping down that chair. And in some braid shops and barber shops, the barbers or cosmetologists that are acting as braiders, you don't have a bowl. You don't have a shampoo bowl. You don't have a place to wash your hands. So in this case and space, you need to have sanitizer. And at the end of this video, we will be showing you how to make hand sanitizer. And what you can also do is make the spray to disinfect your space. But at all times, let's say you go to somebody's house to do their hair, you can wash your hands, but before and after you touch them and while you touching them, continue to use hand sanitizer, especially if you're going to reach for another implement in your bag, like your blow dryer. You don't want to contaminate your whole bag. So the best thing to do is have this hand sanitizer made and have it for yourself.
And I would just add that, yes, definitely it's important. Keep that sanitizer pumping for you and your client, and make sure that you're cleaning your space to keep down all decontamination and spread of the virus. The big question here is there a way to tell if your client has corona? And through research, we have seen that corona, we have learned that there are patients of coronavirus or COVID-19 that are not symptomatic, but they are still contagious. So there is no way for a person to know 100% if someone has corona, but there are these precautions that we have already given you, as well as other steps that you could look out for. But this person would really almost already be contagious if you're seeing these symptoms.
Mhm. Yes, and with these with the coronavirus, adjacent to a client or something like that, the only thing that I've noticed that people are doing is calling the client beforehand and scheduling, making sure that they don't have a temperature, asking them, do they have a temperature, talking to them, hearing in the background, do they sound congested? Do it sound like they have a stuffy nose or a sore throat? Do it sound like they coughing? Have they complained to you earlier that I ain't feeling well, but yeah, I'm gonna still make my appointment? In those cases, you might want to cancel that appointment. But in this nail salon here, I noticed that the nail salon is using gel nails. However, when you do the gel nails on your client, you're not asking the client to wash their hands. That's going to be a violation. Plus, the clients are dipping the finger in the gel nail, so you're going to have to ask them to use hand sanitizer probably 4 times in front of you before they go to dipping their hand after you drill that nail down. because it's going to be a health, safety, and sanitation issue right now. So, as far as the symptoms that the client may have, you really want to discuss that with them over the phone. That's why come now you're doing scheduling. You're doing scheduling. You're doing almost a teleconference call with them that's confidential about their health. And if I was you, in my case, I'm telling them I'm going to take your temperature too when you get here. So because the temperatures in these clients or in these coronavirus people are 100 and above, mostly like 100.
100.4 all the
Yes.
way up until 104.5, which I'm no medical expert, but that's somewhere close to death.
Mm-hmm.
And so we also get the people who are going to say, it's not real, or it's better safe than sorry at this time. Practice the health, safety, and sanitation to your best efforts to protect the industry and yourself and your client, because no one wants to be ill. As Denise said, you know, take those precautions beforehand as far as asking your clients, calling your clients. That's all the way back to that appointment scheduling. It's going to be critical that you set aside the proper time to be able to handle all of it. So you need to get into the office, into your salon, maybe 30 minutes earlier or 45 minutes to an hour earlier to make those phone calls, as well as to make sure you do your morning disinfecting and are able to set up for your first appointment. And then you need to continue to be able to practice that. And don't forget about self-help, health and love. So don't forget to schedule the lunch in there that you've also been missing by having all of this high volume walk-in traffic.
And don't forget to feel as if you can't um, raise your prices. At this point, you see how the play out became with the unemployment insurance, with this CARE Act, and stuff like that, with unemployment and our economics as far as the gig economy. So don't be scared to make more, schedule less people because you've got more work to do in between clients and prep work to do before and after your clients, and don't be scared to charge them for that. You just like if you was a maid and had to do something for 15 minutes. That roll on price needs to go forward with them. And don't be scared to charge them for coming to you with virgin hair, coming to you with a grow out ponytail. Yeah, you got to charge them for those services. So in this economy, I advise you to get your money if you're not going to get any.
So following this, is there anything else that you would like for our industry leaders and workers, drivers to know or understand? Because I know we really didn't touch much. We talked about a lot of hair. We went into the nail. We really didn't say much about those skin specialists that are out there. That's neither one of our prime industries, but you did do massage therapy for a little while. And is it okay for them to wear gloves? They're going to run into people. We all are going to run into people who are going to say, I have an allergy to latex.
Massage
Or
therapists are wearing gloves, and that's mostly the skin industry with the eyelash person. Most of them are using facial beds and they're using face cradles. So that's what they'll be needing to clean and sanitize mostly. It's okay to wear gloves. You can also get liquid gloves. It's not, you don't have to wear plastic gloves. There are liquid gloves that dry and you can work with them. But however you want to use the hand sanitizer before, then you want to apply the liquid glove, and then after that you want to wash really well.
we're
So
we're we're really talking about a sensitive industry here, and this industry is being impacted by COVID-19 in many ways, and it's definitely economic boot in the side of the workers within the industry. And but it's safety and health first. And I've been saying throughout this epidemic that I would prefer my health over wealth, because if I'm healthy when it's all over, I'm going to be able to come back up with that wealth. And especially in this industry. So it's just better to do those safe practices and not be so concerned about what you're losing as far as the economic value. Don't be afraid to say no. No, I don't want to cut your hair. No, I don't want to style your hair. You have to think about, you are penetrating and massaging prime nerves and things in the head that can force a sneeze out. And especially eyelashes and makeup applications and the just the strong smells that come out of some of the nail shops are will make me sneeze. So those are things that you just have to be concerned and considerate about. And we recommend masks, but we have, since we know there is a shortage of masks, we have a video that will show you how to make masks, following a video that's going to show you how to make hand sanitizer, and finally one that will show you how to do disinfectant spray from ingredients that are still on the shelves, household ingredients. These are easily made and they're protective. Again, I'm Gwendolyn Barber from Resources, Justice, and Management.
And I'm Jared from Eco Braiders Association.
And we appreciate you joining us. And we just hope that everyone is healthy and safe in the coming weeks of this epidemic.
Mhm. Now this is being done with one paper towel and two rubber bands on the end. And this is not for your clients. You can make it for your kids. I've been seeing everybody wanting and needing a face mask. No, this one is basic. This is her buffer in front of it. You got to give credit where credit is due. However, she has it's just small 2 minutes on how to make the hand sanitizer. And she put food color and dyes in it. That's what I liked about hers. It was that she was by a mom as well. Mm. She made peppermint and lavender. As you see, she used witch hazel, aloe vera oil, witch hazel. Some people use alcohol, but kids that will burn. So most mothers will use witch hazel. With some tea tree oil in it, or peppermint, or lavender. That was glistening, but some people use it, some people don't. Okay. Thank you, Miss Hand Sanitizer. Look at this little hairdo. Thank you. But yeah, I liked it those. And then this one, as you can see, is disinfecting sprays. Now we didn't talk much about the implements, but yeah, the salon doorknobs, the bathroom doorknobs, and mostly this is all natural. So it's not competing against someone that's saying I'm a natural hairstylist or I do only natural products or I'm allergic to this. Using natural disinfectants is something that I have always done, being that I have chronic asthma and couldn't take on strong fumes. So Lysol and things like that will give me a upper respiratory infection. Bleach, any kind of strong pine sol, and please don't mix all three together. So in this video, you will see her making disinfectant. Keep talking, 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 talking. And we're gonna leave the links to these videos in the description where you can pick it up yourself and get these products if you want to and make it. Now the oils are used, yes, oils are anti bacteria, but the real ingredients is the alcohol and things like that. The oils just help it smell good. Some people swear by the mixture concoction of the oils too, so I can't just say they just help it smell good. That's not so. Yep, and there you have it. You'll have your own sanitizer to keep those stations. Like some people have nice shirts that they purchase that may be pink or yellow or something like that, and they don't want to get rub off the color or mess up the leather. In this case, make sure that you're using alcohol.
Well, there you have it. You have a nice mask that you could create, and not only to protect your um, business, but also to protect your family, because that's a nice, simple mask you could create, like with your kids and other members of your family, also to go to the grocery store and places like that. Sanitizer and disinfectant. Is there anything else you would like to tell our watchers or listeners today?
No, 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 there's nothing else I would like to say. But buy a lot of napkins because as you see, the mask is made out of napkins. You're going to use those same napkins as disposable towels, because we don't know what this virus is doing to cloth. Then you may have to use some of those napkins. They done bought up all the toilet paper, honey. So just buy a bunch of those napkins.
Napkins and rubber bands look like the thing to be.
Yeah.
Alcohol and essential oils, something that has probably historically been removed from us. So thank you for joining us. Again, I'm Gwendolyn from Resources, Justice, and Management.
And I'm Denise from Braiders Association.
Have a nice day.